Jylla Meghalaya mentakasni Patrick Undailur ajar arfo kelayo pan Pynhiar Mynsiem Khyndiat akabdi bagi Jingiakhun persya ya ke jengpang COVID kan kendai. Kadau kolong ba mentakasni kiladan hadu sispa asan penrungut kibriyo kiblayo jengkai nakani ke jengpang klam. Kakam jathu jong ba hek menteri kakot kakya jong Jylla oleh tu pat akabdi pat baki ba yo thamai ya ke jengpang mentakasni kilong saufu arngut nakini arsangut kidai na East Castle District hakabasangut kidai na Kishipai bat arpongut kidai na Kirupai ba. RiKhasi District dan bayok pang tang iway South West Garo Hills laingut West Garo Hills khat laingut West Garo Hills khat laingut hakabri baka jingdan jong kibriu kibrang sya sumar hadu menta nakani ke jingpang uba hek ol yathu ba baro kilong saja lais ba sa laingut hakaba hapa East Hills kilong khandai ba arpongut West Hills lai pongut South West Hills tang iway RiKhasi District sispa khat nyo West Hills khat wingut West Garo Hills Chispa Nyofulai, East Janta Hills Lai Fongut, South West Garo Hills Nyongut, South Garo Hills Kat Rio, East Garo Hills Arpusan, but North Garo Hills Kat Laingut.
So today new recovery, they recovered 156. East Castles 59, RiKhasi District 3, East Garo Hills District 73, West Jantia Hills 1, West Garo Hills District 26. The total active cases, there are 1343, 1343. So the East Castles are 920, West Castles 30, Southwest Castles 1, RiKhasi District 117, West Jantia Hills 11, West Garo Hills 30, East Jantia Hills 30, West Garo Hills Districts 173.
Uba hek hakaju kapor oleh thuru manakala ka sarkar kana pantha chuchu ya jeng rekam jeng bor sumar hapo ka Jylla ba khamtam e apo ke district hakabal thung ye ki committee ban khle da UDC ban ki DMA chokin long ki member secretary shushu uba hek ulo ong ba ula patha ya baro ke hospital ba kino ki pai ba ki bon cha sumar ha ki hospital kimde satya bandu ya kala jeng sumar ula panshairu abasim nongmuna nakamta banap ye ki bapang jeng nakamta banap ye ki bapang COVID-19 kimde satya ban up hadu manayo ya result jaga test nrai kat barang up ya test ru deiban pedrung ha ke hospital ban ajing sumar khamda up satya ban yo ya result jaga test.
The strengthening of the healthcare system in the state of Meghalaya. So today we had the press conferencing, video conferencing with all the MNHO of all the 11 districts. Okay. So we have taken the decision like this. We have told them the DC of the district will be the chairperson and the DMNHO will be the member secretary. So in this strengthening of the health system, now we have already got sanction of 75 crore. It is sanctioned by the Honorable Chief Minister, Sri Konrad Sangma, to strengthen the healthcare system in the state of Meghalaya in all the 11 districts. So we have told them we have to be focused mainly in the CHC and PHC and also in other healthcare center, mainly in the existing infrastructure. Wherever in the existing infrastructure we are having, we can upgrade, upscale and strengthening the existing infrastructure. For example, if it is possible, if we can upgrade it from these PHC to the CHC within the existing infrastructure, existing medical facilities, and also with the existing manpower. Patients are going from any places going to the hospital. See, the few hospitals which I will not be able to name, when the patient has reached to the hospital management, the hospital management authority, instead of taking the patient for the treatment, they are waiting till the test of the COVID test is being done. We have already told them, any point of time, if the patients, any patients coming from any destination, coming to any hospital, whether it is at a private hospital or in the government hospital, we cannot deny any treatment. Nobody can deny the treatment. So what happened all these days, which we have received a complaint, when they have brought the patient to the hospital, it has to be lying there for 24 hours, 48 hours, because they are waiting for the COVID test to be result to be come out. So by the time the health of the patient, it has been deteriorating, and the conditions of the patients has been completely deteriorating. By the time they be take to be recover, it takes more time. That's why we have told them at the same time also together, simultaneously, since we are waiting for the reports, they have to take also for the treatment immediately.